Hello and welcome, medical students. Today we will be delving into the exciting and critical field of emergency medicine. In this comprehensive script, we will explore a range of important topics, from airway management to disaster management. So strap in and get ready to expand your knowledge and skills in emergency medicine. Airway management is essential in emergency medicine to maintain proper oxygenation and ventilation. Techniques include head tilt, chin lift, jaw thrust, and airway insertion. Proper management prevents hypoxia, respiratory failure, and death. We will cover indications, contraindications, and potential complications. CPR is a life-saving technique used in cardiac arrest. It includes chest compressions, rescue breaths, and defibrillation. Algorithms guide healthcare providers in delivering effective CPR. Our video explores these steps and algorithms, emphasizing coordination, compression depth, and minimizing interruptions for successful resuscitation. In the video on shock and hemodynamic support, we will explore the life-threatening condition of shock, its different types, underlying causes, and management strategies. This includes identifying the cause, fluid resuscitation, vasopressor support, and closely monitoring hemodynamic parameters for swift intervention. In the video on emergency evaluation, we will discuss the systematic approach to evaluating chest pain. We will explore differential diagnoses and diagnostic tests including ECG, cardiac biomarkers, chest X-rays, CT, and angiography. This information is essential for managing patients with chest pain. Stroke is a leading cause of death and disability worldwide, requiring urgent recognition and intervention. We will discuss the recognition of stroke symptoms using stroke scales like the NIH Stroke Scale, Alberta Stroke Program Early CT Score, and Cincinnati Pre-Hospital Stroke Scale. Immediate management includes assessing eligibility for fibrinolytic therapy, conducting a non-contrast CT scan, and initiating supportive measures. Additionally, we will explore the role of rehabilitation and various preventative measures to reduce the risk of recurrent stroke. The primary and secondary surveys are crucial in trauma evaluations. The primary survey quickly identifies life-threatening conditions, while the secondary survey provides a more detailed examination for additional injuries. We will discuss interventions and imaging modalities used in these surveys to evaluate trauma patients effectively. Abdominal pain is a common presentation in the emergency department, often requiring thorough assessment and evaluation. We will explore the various causes of acute abdominal pain, including appendicitis, cholecystitis, bowel obstruction, pancreatitis, and peptic ulcer disease. Diagnostic tools such as physical examination, laboratory tests, imaging studies, ultrasound, CT scan, and diagnostic peritoneal lavage may be utilized to aid in the diagnosis. Management strategies may involve analgesia, fluid resuscitation, supportive care, and surgical intervention, depending on the underlying etiology. Respiratory distress is a potentially life-threatening condition requiring rapid evaluation and management. We will discuss the evaluation of patients with respiratory distress, including history taking, physical examination, and the use of adjunctive diagnostic tools such as pulse oximetry, arterial blood gas analysis, and chest X-rays. Management strategies may encompass supplemental oxygen administration, bronchodilators, corticosteroids, non-invasive positive pressure ventilation, NIPV, or endotracheal intubation with mechanical ventilation, depending on the severity and underlying cause of respiratory distress. Altered mental status is a broad term encompassing various levels of impairment in consciousness, mental status, and cognitive function. Evaluating patients with altered mental status requires a systematic approach, considering both medical and neurological etiologies. We will explore the vital components of the evaluation, including the Glasgow Coma Scale, neuroimaging, CT scans, magnetic resonance imaging, laboratory tests, complete blood count, metabolic panel, toxicology screens, and cerebrospinal fluid analysis if indicated. Management strategies will differ based on the specific etiology identified or suspected. Toxicological emergencies due to poisoning and drug overdose pose significant challenges in the emergency department. We will discuss the recognition of common toxicological emergencies caused by substances such as opioids, benzodiazepines, acetaminophen, carbon monoxide, and pesticides. Management strategies include rapid identification of the ingested agent, decontamination techniques, gastric lavage, activated charcoal, administration of specific antidotes, and supportive care. We will emphasize the importance of timely and appropriate interventions to minimize morbidity and mortality in these cases. Emergency evaluation of pediatric patients requires unique considerations due to age-specific variations in anatomy, physiology, and pathologies. We will cover essential aspects of pediatric emergency care, including the assessment of pediatric vital signs, the pediatric assessment triangle, and the modified early warning score, MEWS. Additionally, we will discuss common pediatric emergencies, such as febrile seizures, respiratory distress, dehydration, and pediatric trauma. Proper recognition, assessment, and management of these critical situations in children are key to achieving optimal outcomes. In times of mass casualties and disaster situations, coordinated management is essential to minimize harm and save lives. We will explore the principles and strategies encompassing disaster management, including the Incident Command System, ICS, triage systems, START, Jumpstart, patient flow management, resource allocation, and communication strategies. Additionally, we will discuss the important roles of various healthcare professionals, volunteers, and organizations involved in disaster response. Understanding these principles and strategies will equip you to provide effective care during times of crisis. Well done, medical students, on your completion of this comprehensive video on emergency evaluation. We covered vital topics such as airway management, CPR, shock, chest pain, stroke, trauma assessment, abdominal pain, respiratory distress, altered mental status, poisoning, pediatric emergencies, and disaster management. Your newfound knowledge equips you to effectively handle emergencies and profoundly impact patients' lives. Continue to excel, as your dedication and commitment will shape the future of emergency medicine.